The impact of choosing an inexperienced doctor for dental implants can be so profound. For over 20 years, we've set the standard for expert dental implant surgery and prosthodontics, restoring confidence and beautiful smiles. Each week, we delve into why expertise matters, providing essential insights to answering your questions. Join us to learn how to avoid the common pitfalls and ensure the best outcome for your dental health. Let's begin. Good morning, everybody. I'm Dr. John Willardson here with Memo Hea here at Trust Implants, our live stream. And Memo, how was the week this week?
Week was good. We already talked about this a little bit. Well, we missed the live stream last week. We had some issues, but everything's fixed. Wi-Fi's perfect.
Wi-Fi
now.
was not working last week. It just shut off. I don't know if our viewers were watching, and all of a sudden it just shut off. And hopefully this week it's better.
Yeah, seems like it is. No, we got all the connections great, but no, it was good. It was my birthday last week, so I was in Utah to see my family and my niece and all that.
How's the family?
They're doing good.
Yeah,
you know, they're like I always say, they're healthy. You know, there's always food on the table. You know, there's roof over their head. So that's always a plus. But yeah, other than that, things were fun. I mean, we went to a concert on the weekend with Dane and Seth,
with my boys,
with the boys, and that's always fun.
Yeah.
So yeah, trying to catch up on some sleep.
Yeah, I'm sure.
But, yeah, great. How about yours?
Yeah, it was good. It was a good week. Good weekend. I don't know if you saw this was kind of going viral around the socials. I've always been fascinated with the Northern Lights and Aurora Borealis, they call it. But and this photo, you couldn't see it from the naked eye. You had to use your phone and a camera, but you can see this. We were in Utah, so we were able to. This was actually last weekend, but it's always been a kind of a dream of mine to be able to see that, and we were able to catch that because it came. The way it works is, obviously way north in Alaska and Iceland, Greenland, or Norway, all those areas you can see it all the time. But as it comes more south, we usually can't see it. But and we have a place in Montana, and they say that you can see the Northern Lights there all the time, but I hadn't seen them yet. I thought, oh, this is a myth. There's no way. I want to see a bear, and I want to see the Northern Lights. And in Montana, I've not seen either. But so we were able to see that. It's really cool. Like it's amazing because it's kind of, again, evidence and manifestation of God, and that the fact that we as men and humans, we think that we're all powerful and can do everything, but in reality, we can't do anything without God. Which maybe that'll lead us into our little spiritual moment here. And so I'll read a quick little scripture, and then we'll get in on the live stream. And this says, "And wherefore, whoso believeth in God might with surety hope for a better world, yea, even a place at the right hand of God, which hope cometh of faith, maketh an anchor to the souls of men, which would make them sure and steadfast, always abounding in good works, being led to glorify God." Last week when we talked about neglect, right? And just what happens when we neglect, whether it's our mouth, whether it's our physical bodies, or whether it's not exercising, or our minds, or our relationships. The antithesis of that would be hope, right? Because if I have hope that my thighs can get bigger, I'm going to go to the gym and I'm start doing curls, right? Mm-hmm. Or if I have hope that I can maintain my teeth, I'll brush them, I'll floss, I'll do all the things necessary in order to maintain them. But the moment that I lose hope, I neglect. That's the opposite, or the antithesis of hope is neglect. And so, if we can always skew and lean towards the side of hope and because it's really, I mean, that's kind of life, right? It's either we fall into the depression or no hope, or we have hope. And so, a lot of times when I see patients who come in and they've lost that hope, and they have, gotten to the point where they've just given up on their situation, or sometimes, like in this case here, they had hope, and they went and they spent a lot of money and tried to fix it, but then it didn't work out. And it ended up that implants had to be taken out. And so that's also very discouraging, and is something that, we see quite often here, which I was watching, I was kind of, again, like I mentioned in other live streams, I pretty much only watch YouTube. I don't watch TV. I don't watch the news. I have no idea what's going on in the world. Like before the stream started, you were mentioning some of the stuff that's going on politically and in the news, and I haven't even heard anything. But and so, and a lot of these venture capital implant centers now that come in and say they'll do teeth in 24 hours or teeth in a day and final set of teeth in 24 hours. That's becoming, they're inundating the landscape, right? They just flood the market with their ads and with their videos. And so on YouTube, if you search up dental implants, now it's like teeth in 24 hours, right? Like you get your teeth tomorrow if you come with us, but it's just simply not reality. And
well, doctor, I know we were going to talk about this.
Yeah.
Now that you bring it up, is sometimes I call these other implant centers. I'm not going to say their names, but if you look it up on Google,
they're corporate.
Yeah, they'll pop up.
Yeah.
They pay enough to be on the top 3 or top 4 of the Google search. So I'll call them because I want to know what their process is when they're trying to, either they
Plus
charge.
your mom needs implants, right?
Yeah, she needs a few. And I always use like the card of, well, she does. Her English is very broken. So I'm like, look, I'm helping her. I'm translating it. So that's completely true, right? And I called this place yesterday, and he was like kind of upselling me. The reason why you should go with us is because we get it done in 24 hours and everything is in-house and this and that. And there's financing. And he's like, I can waive the consultation fee. And I'm like, well, hold up. I'm like, this is an expensive procedure. It's about $50,000, right? And he was like, yeah, sure, it's around there, ballpark. And I was like, I obviously going to do my research, right? If I'm going to buy a car, like before I choose a car, I'm going to, see what
do your research,
best gas mileage, like reviews on the car, what would be best for me. And if I have a family, if I'm just by myself, same with the house, right? I think Robert Kiyosaki says the same thing. Anything that's
of value,
that you're going to spend a lot of money and you're going to spend a lot of time with, you have to do your research. So I told him, I was like, everything I've looked up online says to avoid the 24 hours in one day. And I was like, and it makes sense because there's a healing process. And
there's no, like I said before, there's no magic. There's no magic potion. There's no magic graft material. There's no magic implant, and there's no magic technique.
Yeah. Well, I'm also thinking about it this way, right? Like, let's say I work out a lot, right? I'll go do jiu-jitsu or boxing, and something happens to my shoulder. And if the doctor says, I'm the doctor that can fix it in 24 hours, you can go back to boxing.
Such a good point.
I'd be like, yo, listen.
I know my body.
Yes. I'm like, even if I fracture it or something, I have to wait. Like I fractured my ribs. I had to wait 3 to 6 months just for them to heal. There was no surgery involved, no nothing, right?
Yeah.
And so I told him, I'm like, why would I go to a place, pay $50,000 and walk out and just hope everything worked out fine?
Such a good point, Memo, yeah.
And the guy was like, can realize that he was like, didn't know
his
where to go.
sales pitch wasn't, you weren't buying it.
Yeah, but his answer to my objection was like, well, yes, I agree with you, but not everyone's candidate for the 24 hours, right? He's like, if there's bone grafting, there is a healing process and this and that. And long story short, he didn't know what to do with that question. Mm-hmm. And so that's why we keep telling, patients or potential patients is, you got to educate yourself and ask these things, because
100%.
if you don't know this, he can sell you in the 24 hours and, you pay.
Sounds great. I mean, like you said, with your shoulder or, any injuries that I've had, I would love to be back on my feet after I broke an ankle years ago, mountain biking or whatever, and be back doing what mountain biking again the next day after a broken ankle. But that's just that's not possible. The body has to go through its processes. It has to, the bones are, and I think I've talked about this in the past. So if you look at the healing properties of bone and just the physiology of a fractured bone or healing bones, there's something called Frost's theory. And in Frost's theory, it talks about that one sigma is 3 months. And so the first phase of healing is 1 sigma, that's 3 months. The second phase of healing is 2 sigma, that's 6 months. So every 3 months, the bone is maturing, becoming more dense, stronger, harder. And you can't break those rules. And that's why I like to start our live streams with talking about God, because it truly is, there are laws, there are rules that cannot be broken. And if you try to go around these laws and whatever, even in the 10 Commandments, right? Like if you try to skirt around some of these laws, eventually you might get away with it for a while, but eventually it's going to come back and bite you. So, I love motocross, and motocross is a very dangerous sport. We, all of my boys and my family, we follow all the riders, and we know a lot of them. And one of my favorite riders, Cooper Webb, who fractured his thumb a few weeks ago, and then I hear yesterday he's going to be racing the next national, which is this coming weekend. And I'm like, there's just no way you can ride effectively and not re-injure the area, or there's just nothing. I don't care if it's hyperbaric oxygen treatments or PRP, or there's all these things, stem cells, that we think that we can, just fix it fast and easy and then it's done. But we cannot break those rules of like the sigma. It has to heal for 3 months. That's the first phase of healing. The second phase of mature healing would be 6 months, really. So to think that I'm going to go in and have my teeth pulled, put in dental implants into the bone that requires a minimum of 3 months of healing, ideally more like 6 months. And nowadays, with surgical technique, I can get a lot of torque on the implant. So I know basically kind of the tolerances of that, of when I can load, because when you put the pressure or the teeth on the implants, that's loading, right? You're putting the load forces on it. Mm-hmm. And so they call it immediate loading, where you put the screw in and you load it right away. So that's one factor. But then you consider the fact that they're only loading, or they're using only 4 implants. So if one of those 4 implants doesn't work out, now you have, and they call it none on 3. So you either have all on 4 or none on 3. So, but it's true. Yeah. Like, as you're saying with your shoulder, your body, like you're not going to go get in the ring, even though you might even have a doctor say, hey, you're good to go. I mean, get a cortisone shot and some PRP and stem cells, and get back in the ring and start, go for it. But your intuition tells you, like, that's not a good idea, right?
Yeah.
And patients are the same way. They know that. They know that it just does not sound right. I would love to know, and there's no way we could ever factor or quantify this. One, I'd love to know the materials that they're using, the graft material, and also the number of cases that they're actually loading in 24 hours, same day or whatever. I bet you it's less than 5%, even though their entire marketing scheme is around teeth in 24 hours. So they've built that around a very low number. I don't know. It's probably maybe 5 to 10%. I can't imagine it's more than that, unless they're really pushing and risking their entire practice, because as a doctor, I know when I can load a case or when I can't. So,
well, you know what? Now that you say that, I agree with you, because that, like, the way that they're selling it is like, just come in, you'll have, because ultimately what the patient wants is their smile back.
Yeah.
And if you tell them it's a long process, like, they're really going to think about it. And it makes sense from their end as, hey, you'll walk out in 24 hours, but when they come in, like you said, 90% of them aren't candidates, and that's when they explain it, right? It's like, hey, for you to,
right.
For this to be able to work out good, you're actually not a candidate. It's going to take longer than that, but at least they're getting him through the door.
Exactly.
Which is what we talked about last week is, the unethical clickbait type of marketing.
Yeah. Yeah. Just that clickbaiting. And, which kind of like, so I was watching, we did that piece months ago. It was probably actually more like a year ago, on that news reel in Arizona. Remember that lady that they, it kind of went, in the dental implant world, our tiny little world, but it went a little bit viral. But they came out with another one. And this one, again, they're pushing the idea that dental implant injuries are surging. And it's because of the fact that the practitioners doing the procedures are not trained. And actually it's true. I mean, what she says, and we could watch it, but we'll just kind of scroll through. But, she talks about how,
I don't want
and this is the patient who,
I don't want to be
that had
trying
gone
to
through the
convince
procedure.
doctors.
But when I looked at her x-rays and her CT
my mouth
scan,
is
like
making
it
me
was an
sick.
absolute disaster, and ended up in the wrong place. And now she has ended up in the quote unquote right place. But, these guys must have called her and said, hey, come in and we'll fix your case and do it for free. But a little bit of deep dive on their practice. These guys aren't trained either, but they're promoting and saying that they, that there's the doctors doing the procedures have no background or training in implant surgery. And they do kind of a little bit of a research. They call the ADA,
Sticking
they
out
call
of her gums
CODA,
are
which
too
is the Center for Dental Advanced Education, and all of them declined to answer. So declined to answer, what is the protocol for doctors or dentists to place dental implants? And they wouldn't answer that question. And the reason is because there is no protocol. Like, there's no standard, there's no standardization. And that's why, I say it's like the wild, wild west out there for patients. You have these companies talking about teeth in 24 hours, all on 4, get it done now and fast and problem solved. But in reality, again, you cannot bypass these laws that just have to be followed. And anybody with any ethics or training will not bypass those laws. We're not going to do things that are outside the capabilities of what we know the body can handle. So, but anyway, so she ended up in just kind of a disastrous situation, made a good decision and called the news. The news comes in and they do this whole thing around her case. And
wait, doctor, is that the same lady from the video that we?
Yeah. And so this is a second news piece that they talk about. And now here's the doctor talking about her case, because they must have called her and said, okay, we'll fix it for you for free, but we want to be on the news, And their point is that, and the doctor's talking about how the implant positioning is poor, which is totally right, it's correct. But now the question is how are they going to solve this problem? And they don't really show their outcome. One, because it's going to require somebody with some real skill set. I mean, somebody that knows how to manage a case like this, regenerate the bone, place a proper number of implants, graft in the sinus, work around the nerve. You see this yellow line right here. That's the inferior alveolar nerve. So they have to remove all these implants. So this guy talks about how he was trained at Loma Linda. He was not. Probably went to dental school there, but he did not go through bona fide implant surgery or prosthodontics training. He maybe, But, and they talk about the number of devices or failures that are being talked about or promoted. So in 97, it was very low. But as these corporate centers start to come into play, because
Oh my gosh.
Yeah. So, but it's the corporate centers, they're saying a 98% injury to patient.
Yeah.
But that's just not, I mean, I don't know how they're coming up with these numbers. I don't know how they're quantifying this. But in my practice, and I think you could look at each person, if you have a practitioner has their own practice, you could look at their practice individually and the numbers would be totally different. Like, in my practice, not because I'm anything great, but the fact that this is all I do, and I do know the dynamics of the bone, and I do know the tolerances of each patient. And so I manage the case accordingly. You'll never see an ad from Trust Implant saying, you're getting your teeth in 24 hours. I just won't do that. And I knew that from the beginning that would not be a good marketing strategy. But like you said, it brings them in the office. It gets them thinking, oh, this is an easy fix,
Yeah. Well, also with this, doctor, what I'm thinking is I'm glad these news stations are creating this awareness.
Yeah.
Because now people are actually going to do who's been watching us, they've seen that we've been talking about this for years.
A long time,
for years and years. And we keep saying, do your research, because all on four of these implant centers, the failure rate is high. And now you don't have to believe us. Like, it's in the news. They did the research. They keep coming out with this. They just showed the numbers. I mean, in a way, it's good for us. And then also what we see here, because, I don't want to say high percentage, but, about like 30%.
Quite a few,
right?
yeah.
Quite
probably.
a few percent of a percentage of our patients are these type of patients who went somewhere else. It's painful. It failed. Prosthesis cracked. So they're right back here. And it sucks because they have to pay double, but that's what we're trying to do.
Make awareness.
We don't want you to pay double. Do
Right.
it right once. And to your point also that never happens here, it's because you are the one in charge of the case. You can't, even if we could take 50 patients a month, you wouldn't be able to do it.
Can't do it.
There's no way. And so that's why we tell people when they're trying to book a consultation is, hey, he won't have the time if you miss this appointment, right? Or there's days that all day you spend back there doing surgery. So you can't see other patients for prosthesis or even new patients, and they have to understand that. But it's because, again, you hardly have, or you don't have a failure rate, and you take your time to do it. It's not like these big corporate centers.
Yeah, and I've had my own failures. I mean, I've had implants fail, but the number is so low that I've been able to continue to do this for the last 22 years. But with, and that's and that's why I would love to know kind of what their failure and or success rates are and what materials they're using at this 24-hour implant center. Because, one, you'll never know that. You'll never know really what their failure rate is. I would imagine it's extremely high. Given the amount of money that is behind them, just looking at the content that they're pushing on YouTube and all over the internet, they're building and creating content all the time and pushing it out there. And the algorithm offsets it, so it looks like they are the biggest. And they may be, the biggest implant center in the country, but their promotion and their message is very dangerous, I think, for patients who really want this to be successful. And we have patients who come from all over the country, Atlanta, all over the place, New York, Florida, Texas. But it's those patients who've done their research and they're willing to make the drive out here because they want success,
Yeah, of course. Well, that, and then just to add real quick, doctor, is when I talk to these, all on four 24-hour implant centers, their thing was, well, look at our reviews. We have thousands of great reviews. And here's the thing with reviews. you're not going to know if your implants or your full mouth reconstruction failed till a few years after, right?
Yeah.
Like it's just how it's going to happen. So yes, someone can leave a review, but then 2 years later when this is happening, there's no way Google's going to let them back and be like, oh yeah, let me change up my review.
Well, and you can also buy reviews, and Google in the last 6 months, I think they kind of changed I had a ton of reviews, like over 450 reviews, and they all got lost. And now I think there's like 20 or something,
Yeah.
So, and patience, and I get it, when you're making a decision like this, you want, you check reviews. When I go to a restaurant, I check reviews, or if I go for a auto, tire replacement or something, I may check reviews. But when I'm doing a surgical procedure, a Yelp review or a Google review does not reflect the skill set that the surgeon has or that I have, has nothing to do with it. In fact, my patients, recently we've been asking for reviews, but for the last 15 years, I've never asked one patient for a review. It just doesn't, But nowadays you've got to stay with what the market requires, and the market requires that you have lots of reviews and they're all 5 stars, and and I've probably just been too slow to act on that.
Yeah. Well, and that, to me, that's a little funky too. We're going to right away, but if I see a place and it's got 500 5-star reviews, I think it's a lie.
It's a question, right?
Because any business is going to, anyone who's ever owned a business knows that you're going to have those unhappy customers for no reason that are going to leave reviews.
Oh, yeah.
And even like the bad reviews, it's good to read, because then you can see if it's one of those, they call them Karen patient or, customers. Mm-hmm. And then you see why, like the girl in the front didn't smile at me. I'm like looking at it, it's like, okay, that's a valid review. And like, that's their.
And maybe it's true.
Yeah. It could be true. But when it's like, perfect 5-star reviews, 500, 1,000 reviews, I'm like, you guys are doing something fun. There's no way a business can be perfectly ran.
Yeah.
Like even places like Apple, or like Microsoft, you get bad service from them all the time. They don't have great reviews. Oh my gosh.
Can you imagine if you could give Apple reviews or Delta Airlines or, but when you're big enough, you don't care. When you have enough money, you don't care what the reviews say.
And that's what I'm saying. We all know that these big, well-known corporations, their service sucks.
And it's gotten worse, right? Over the years. Since COVID, it's just, there is no customer service,
So when you look at a place and it's got all perfect, I'm like, okay, that's a little funky. But anyways, that's, we can move on, because I know we're a little short on time.
Yeah. I mean, just real quick on the review front. I mean, of course, I have good reviews, but there are some on there that are not great. But that's usually the one that I am thinking of. It's a guy that I did an absolutely perfect job on, but then at the end of the day, he wrote a bad review on me, and I'm just questioning why. And then the other bad review I have is actually from the dentist that was previously in this suite, and his secretary wrote a bad review on me and talks about all kinds of stuff. And you just can't, I have no control over that. I know at the end of the day, what I give to my patients, I give them 150%. At the end of the day, I give them the very best potential, the best outcome possible given their situation. That I do know that can't be put out there on a review. There's no way for a review to reflect the heart tissue that I burn on every single patient and the effort that I give to every single patient. So reviews are important, but at the end of the day, I can't worry about that.
Yeah, and it's it's the opinion from their end.
Yeah,
it's usually the ones that didn't get treated. But I do have a few questions from last week, Doctor, or 2 weeks ago, from what we had talked about. We had watched Dr. Andrew Huberman's video about oral health.
Yeah.
And he mentioned there was a few factors, but I wanted to talk about other factors beyond brushing and flossing every day that could, help affect or.
So yeah, that's Now, if we're talking about natural teeth, so just your teeth or my teeth, well, let's look here. So that's the after photo. This is a pre-op or before photo. And the reason I show this is because this patient has tried to do everything in her power to fix her mouth. And it's hygienically, if you look at the tissue, it's very clean. It's not neglected, but if you'll notice the dentistry that's been done and the quality is not great, right? So the most she can possibly do is brush, irrigate, floss the best she can. But the fact that there's so many traps of areas around all of this dentistry, it's inevitable that she's going to have major problems, which she did and ended up having problems, which we fixed. So it's multifactorial, right? If you have just like your own teeth and all you need to do is brush twice a day, floss, and just keep your mouth clean, right? When your mouth tastes nasty, right? So you're like, I just need to brush my teeth. But now imagine if you had a bunch of devices, bridges, crowns, partials, even implants. Now maintaining that it's a whole nother level of maintenance, right? So this is on natural teeth, but a lot of crown and bridge or dentistry. Now, if we look at implant maintenance. So here are a mouthful of implants. This was a case we did last week. I didn't place these implants, but patient comes to me with all sorts of inflammation, debris. You can see down inside just how disgusting, and there's a lot of debris down in this implant. That's the design of the implant that's causing this, the design of what's called the crest module, which is the top of the implant, and how everything connects to it. Because of the design of this, the junction of where the prosthesis, the teeth meet, and the implant meets, it's basically, microns in dentistry is a mile. That's a lot of space. And so there's so much space here that all that debris is just working its way down inside the implant. And imagine having like a hole in your mouth, which what an implant is, right? And stuff's just going down in there constantly and just harboring this debris. When I take these prosthetics out, when I took this thing out, the smell is, it'll knock you over, right? But then, I could talk about this stuff all day long, but notice, so we looked at the implant, right? And the design of the connection of the implant. So the implants that I use have what's called a Morse taper. So in fact, let me go to, we'll come back to this picture, but if we look at, this prosthesis here and how the prosthetic emerges into the implant and then how the parts and pieces connect to the implant, with the implants that I use, it creates a seal so that I don't end up with, when I take the prosthetics out of the mouth, implants that I've placed and that I've done, I do not see this ever. Never, never, never. So the patients, again, that's a clinical choice of mine. I have to choose what implant I'm going to use, the prosthetic design. There's so many factors and variables that I have to choose when I'm doing each case. And I consider them carefully because I don't want to see this 5 years later, right? I don't want to see all of this debris. The patient cannot clean that. There's no way to gain access here. I have to remove it, and even then I got to irrigate and sterilize it. And so that's one thing. That's just the implant itself. And then you talk about the design of the prosthesis. So this whole thing is just a mess. The type of metal that they've used here, it looks like it's rusting, so there's some sort of corrosion going on. It's impossible to clean because of all the undercuts and the design of it. So anyways, long story short, there's so many details in doing these cases that, the teeth in 24 hours and let's get it done quick and fast is just such a bad idea because these factors are not considered on every single case. And everything from the implant design, to the number of implants, to the position of the implants, to the materials that they use to replace the teeth is all critically important. Like if we look here, these two implants are literally right next to each other. And so when I took this out, I cleaned out all kinds of debris in between these implants, which caused the bone to separate between the implant and so it's just another kind of void where stuff can, pack down inside of there, and the patient can't clean it. So, your question was basically with Andrew Huberman and maintenance and hygiene and what are some things we can do. The reason I kind of went off on that little tangent is because every single patient is different. It depends on what they have in their mouth and how to maintain it and what is needed to be maintained. And so there's a lot of variables and factors involved when we talk about that.
Thank you. And then also the second question was about the patient from Atlanta that, we keep discussing that we don't do teeth in 24 hours like other places promise. And in a situation like this that we get all the time, like patients coming from Atlanta, New York, Florida, what will be like, what is the timeline like since, they have to come in a few times and it's not a one.
That's a good question. So we're going to streamline the process as much as we possibly can for every patient, whether they're flying from out of town or if they're in Southern California. And I'll plan the case out. I'll plan their surgeries and all the steps to get them finished as quickly as possible without pushing the envelope, without breaking these rules and laws that just cannot be broken, so that in the end, once it's done, they can go back to wherever they're from and have confidence that the work that was done correctly. Yeah. And so during that process, the patient has to have some patience because whether it's 3 months, 6 months, 8 months, whatever the number is, we work out a plan so they know how many times they'll have to come back and forth. And we also coordinate it so that when they're here, we capitalize on the time that they're here so we can finish the case, in an effective manner without them having to fly back and forth too much. So,
and doctor, I'm sure a lot of viewers have these questions, or this question specifically. Why would all these patients from other states come to us, come here to get treated and are willing to go through all that? Because it happens quite a bit, right? Is it because they don't offer what we offer in their states?
I don't know, actually. I truly have no idea. And it's kind of because of this news piece that we talked about, because there's no standardized protocols. So whether it's in cardiology, whether it's in neurology, orthopedic surgery, whether it's dermatology, whether it's there's protocols. And you go to one orthopedic surgeon that was trained at NYU, and you go to another orthopedic surgeon that's trained at Loma Linda University, they're going to have a similar mindset, maybe some different techniques, maybe some different philosophies. But at the end of the day, when it comes to doing an ACL repair, they will have a fundamental, treatment protocol that they use that's going to be very similar. Whereas if you go to one dentist who's doing all on 4, all on whatever, and because there's no set protocols, you're going to end up with a completely different plan, different materials, different outcome. And I go back to like the wild, wild west theory, right? It's the wild, wild west, and there's no set protocols. Therefore, dentists are just doing kind of whatever they think is best in the moment,
Yeah, and I would say the people that do the research are the ones that fly all the way here, because I've talked to them a little bit and they just say, everything you guys talk about on YouTube makes sense, like the bone grafting, all on 6, like placing more implants, not only 6 but sometimes 8 and 10. And yeah, like we talked about, the one from Atlanta is family. A lot of them are dentists, so they understand this. And
Absolutely,
and it makes
which
sense.
I was very appreciative of that because, being the fact that his dad was a dentist and multiple family members were dentists, he did his research and he made the right choice. But not everybody has that ability, right? Not everybody has the foresight to do that research, and then they end up they never learn about us or what we're doing here. So, so it's just a matter of, really, like you said, when you are going to buy or make a serious investment, you do research and you do your due diligence so that you know what is the best path forward for you.
Yeah. I want to move on to, because we only have a little bit of time left.
Yeah.
Let's move on to the case of the week, if you have one to show. But while you find it, I just want to talk about that. Because what you just said made me think that, usually when we have friends, even investing is something similar, right? Because I like to trade Forex, and before I enter a trade, I do my analysis. I look at, if I'm buying a company stocks, I look at their financials, how they've been doing, what other people are saying, and then I execute the trade. But now that we talk about this, it makes me think, because it's happened to me and it happens all the time, where I'll be like, hey, doctor, this stock's going to boom. You should buy it, right? And you don't even do your research, but it's just because I
believe you.
You believe me.
Yeah. So if you came to me and you said, hey, buy this, I would do it. I wouldn't even hesitate because I know you know what you're talking about,
So, and it just makes me think the same. People just react like, oh, I got my teeth in 24 hours. It was, super easy, simple, blah, blah, blah. And just people don't do their research and they jump into it. So same with cars and I guess houses is.
Yeah, pretty much anything, and it's kind of human nature. Just we want an answer fast. We want a result that's fast. We want to solve the problem fast. But there's certain things that, a shoulder repair, fractured ankle or fractured rib. When it comes to the body, you cannot speed up the process. It's just not possible, and so and you don't want to, with your shoulder, you don't want to push it, even though somebody might tell you, yeah, get this shot or take this pill and you're going to be good to go. And inherently, that that's not the case. So I don't know that I've shown this case before, but this is a patient who, obviously, you see there's a ton of implants here, right? I mean, there's, let's see, we got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11 implants to support a denture. And so this is a denture snapped on to these, and they ended up only utilizing 5, I think, of the implants to support this thing. So again, patient spent a ton of money. I know that. Ended up with a lot of implants and ended up with a denture. So, and the reason he came to me is because the thing was just flopping around and falling out and not connecting. But so there's a lot of stuff going on with this case. One, there's a lot of bone loss around each implant. Positioning is not great. And this was done by a board-certified oral surgeon here in Southern California, which, the issue there is the fact that there was no prosthetic plan. And so because there's no, sometimes the patient will get sent to the surgeon on the prescription, it says place dental implants. So implants are placed randomly and haphazardly and ends up, with a situation like this because there's not a plan, and it's not the surgeon's fault. It's just the fact that, if you don't know where you're heading, like when you're, in archery, if you don't know where you're shooting your arrow, that thing's going to go wherever. And so you have to know exactly where you're headed in order to get an outcome that you can anticipate and predict. And so, and that goes for, any of the, that's why we're able to predictably methodically achieve the outcomes that we're able to do, because I know exactly where I'm headed. I know where the implants are going. There's just no question as to, my goal is to get teeth. The implants are a means to getting the teeth that are permanent and fixed. And so my goal isn't to place implants. My goal is to give the patient an outcome that they can, feel good about. So.
Okay, perfect, doctor. That's I don't think you've showed that case before.
Oh, really?
That was good. And again, we only have a little bit of time left, but I do want to go over a few other questions from viewers from, just previous videos. It's not really a question, but it's just kind of, they wanted us to cover like the variation of cases and their timelines.
Okay, yeah, that's a good question. So, all right, let's say, for example, I received this case directly, and I didn't have to pick it up, from having had a failed prosthesis and implants already placed. Had I gotten this case without having intervention from other doctors, I would have put the implants in a completely different position. I would have buried them a lot deeper, and I would have made the prosthetic, like with the zirconia, and used a specific type of implant for this patient. So as far as the timeline is concerned, for the lower jaw, because it's more dense than the upper jaw, and also the variation and the anatomy of the upper jaw, the mandible, or the lower jaw, or the mandible, the anatomy is pretty straightforward. There's just a few things I have to highlight or identify, which is the inferior alveolar nerve and the mental nerve. And then in the front here is called the symphysis, and so I just need to kind of understand and know the anatomy and know where I'm working and what I have to avoid and how much bone I have to work around. So the mandible or the lower jaw can be done quickly within 3 months. And that's not pushing the envelope, because normally I'm going to get very high torque values on that case. I am waiting 1 sigma, so that's about 3 months. And, so the tolerances of that I know I can anticipate. Now, on the upper jaw, that can differ quite a bit. I don't know if I've got any photos. Let's see. I've shown this case a million times, but this is a good one. And this is actually, it's not completed yet, but here you've got some decayed dentistry, old dentistry, bridge fractured, and so the patient needs full mouth upper and lower reconstruction. I have to concern myself with the anatomy of the sinuses, of the density of the bone in the anterior of the premaxilla, the front of the upper jaw. So this one I'm going to have to navigate a little differently. I'm not going to say we're going to get this done in 3 months. We're probably looking at more like 6 months, because a lot of stuff going on here. It's not completely straightforward. I have extraction sites, so I'll pull a tooth out. There's going to be a hole left here. I have to graft that site, and then implants will go in. So the timeline just is specific to the patient and to the case. I'll always kind of go by that so that I can have outcomes that will be successful and predictable.
Okay. A second question is, what are the main causes for bone loss and an increased timeline for the case?
Okay, so increased timeline would be bone density or anatomic or infection. Like, for example, one reason I wouldn't push this case hard, meaning push it in the sense of try to push it to completion too hard, is because she had multiple areas of infection in the bone. And so even on a CAT scan or an x-ray, I don't really know the dimensions of the damage to the bone until I've pulled the teeth out and I've cleaned up the infection and we sterilize the area. We irrigate it with antibiotics so that we can kind of, once I pull the tooth out, I'll clean out the infection, but then we sterilize that area and then graft it. So I'll be left with a defect that could be very different than it might show on an x-ray. So I'll have to navigate that area, according to whatever I'm presented with. So the timeline variations depends on the anatomy of the patient, depends on defects in the bone, infection, extraction sites, teeth. It's all very dependent on just what's going on for that patient. So that would delay the final result. And I just, like I said, I'm not going to push it because I want to get a good outcome for them. So,
of course. All right. And the last question is, what would your recommendation be to those considering one day or 1 week promises elsewhere?
Yeah, I mean, we've kind of talked about that quite a bit. You're just, again, every individual, every person there, whether it's within their health history, diabetes, cardiac, vascular, hypertension, you just can't say to every person that we're going to do this in a short timeline, because each individual comes with their unique challenges. So it's just not reality that you're going to do that and do teeth in 24 hours on every case. That's why I'd love to know what that number is that they actually do.
Yeah. I mean, I would add to it and just say avoid it.
I would say so too. Yeah.
Well, anyone who's selling you anything that like get rich quick, type thing, like you'll buy this coin to get rich. Anyone who's, it sounds too good to be true. Like, yeah. I feel like we've known that for thousands of years, right? That it's probably not the way to go. But
yeah, I wish that we could get this message out to more people that are in need of this type of work. Just because they can avoid so many complications, so many issues, and but we'll grow as we grow, and hopefully we can get more people can see it, recognize it, understand. We're talking about truths here. We're not. I don't sell anything, any snake oil. I do use exosomes, stem cells, PRP, platelet-rich plasma. Every single thing that I can do to benefit and help the healing process for every single patient, I'm going to do that 100%. But I'm not going to, I know the tolerances of that. I'm not going to push it to the point where, where I'm going to have a complication.
Yeah. Awesome. Well, that's it for today's live stream, Doctor. I don't know if you have anything else to say.
No,
but if not,
no, thanks, Memo. I appreciate your questions and input, and we appreciate our viewers. I know that as we grow the channel and as we put this information out there, if you've got friends, family that are, that may be needing this type of work, share it with them, subscribe and hit that like button. And, hopefully we're getting better and better at these live streams. We've been doing it a while now, but we're still, I'm not very good on camera. So, but thank you all for watching, and we will see you next week. I'm Dr. Willardson with Memo Hea, Trust Implants, trustimplants.com. We'll see you guys next week.